Hi, my name is Sagir Ahmed. I'm a pharmacist with Green Life Pharma. This is Nabil, also a pharmacist, and my daughter Sophia is our little assistant for today. So we thought we'd create a short video on medication you can buy over the counter at the pharmacy to do with coughs, colds, sore throats, congestion, coughs. So Nabil, what are the options?
So initially, if we start with sore throats, your options range from your simple lozenges and sweets. For example, you've got your soothers, which come in different variety of flavors. Also Jakeman's, which is another product that you could probably use, ranging to lozenges, which come as Thai rosettes, or you could use sprays or rinses, for example, Cavonia, or the more effective, in my opinion, the Diflam. The Diflam contains an anesthetic which numbs the back of the throat, which makes it easy for patients to swallow and helps to relieve any pain. Strepsils, which are probably your most commonly known lozenges, yes, they are more expensive, but they are medicated and, in my opinion, most effective.
Okay, I know the soothers and your other sort of lozenges, they all come in different sort of flavours. So I know you like the cherry, peach, blackcurrant, yeah? But you don't like, which ones don't you like?
Lemon and cranberry.
Cranberry, why?
Because they taste a bit bitter.
Yeah, a bit more bitter tasting.
Yeah.
Oh, okay. Yeah, so then moving on to tickly coughs, what are your options?
So with sore throats, your main association would be a tickly cough. There are a range of different products that you can buy. They do mainly contain sugar or sucrose or glycerol, which, to be fair, most products are usually the same. It just comes down to patient preference and flavour.
Yeah. Some of them also contain dextromethorphan.
Yes, which is a suppressant of the cough, which will help to hopefully relieve and or suppress the cough itself.
Okay. So what are the differences in a tickly cough? And a chesty cough? And what else do you get with a chesty cough?
You get this green stuff coming out.
Wow. Okay. So then moving on to chesty coughs, so what are the options there?
So with chesty coughs, again, different brands have different flavourings and different ingredients, but to be fair, your main ingredient would be an expectorant. Now an expectorant works to help break up anything that's on the chest and help to just bring it up and help to relieve that cough itself.
Now a lot of the expectorants, they contain an ingredient called guaifenesin.
Yep.
Right. Now some people will say that there's not enough scientific evidence to suggest that the guaifenesin is effective at breaking down the mucus. In your experience, what do you think?
To be fair, in my experience, the best way that you can actually say how good a product is by patient feedback. Now, patients tend to take a lot of products which contain that ingredient, and to be honest with you, they always have great feedback. They always say that it tends to work and it's probably the best thing that they've used. So, in my opinion, I'd say continue using it.
Okay. So what are the options? And more importantly, you as a pharmacist, which one would you recommend?
To be fair, my personal opinion, and to be fair, the one that I tend to recommend to all my patients actually isn't on here.
Yeah.
I'd go with the Robitussin. It's the safest to use with, for example, if you were to take any medication. A lot of the time, expectorants tend to alter heart medication and your blood pressure, whereas this would probably be your safest.
Okay, but you've got options of your Cavonia, another Cavonia here, your Benylin, but I remember when I used to work frontline as well, I think this always had the best feedback as well.
Yep.
Okay, so then moving on to congestion. So what really is congestion?
So congestion is classed as pain and blockages of the passages around the nasal cavities, around the forehead, and radiating towards the ears. Easiest and most effective products that you could probably use for congestion would be a decongestion, which, as you can tell by the name, helps to decongest the area. So you've got Sudafed or Sanitab, which are the two most effective products you can buy. Now the Sudafed contains what's something called pseudoephedrine, which is also part of Sanitab. Sanitab, to be fair, in my opinion, would be the more better product to be using.
So that also contains paracetamol. Well, the Sudafed is just the decongestion.
Just the decongestion itself. So the actual paracetamol and the Sanitab will help to relieve any pain.
But then you've also got the likes of your Albasoil.
Yep, Albasoil, Vicks also do a nasal spray, vapor rub, all help to open up the passageways around the nasal cavity. Yes, they are effective, but like I said, the Sanitab containing the paracetamol will help with any pain, which is probably your better option.
Okay. And then you've got your combination products.
Yeah, your combination products branded as, for example, Day and Nightness. You've got your Lemsips, which everybody knows, Beechams. They contain paracetamol. They also contain other ingredients which help with coughs. For example, the guanfacine that Sagir mentioned earlier.
Yeah.
They also contain phenylephrine or some sort of decongestion, which will help with all the other symptoms. Paracetamol obviously is an antipyretic, should I say, which will help to relieve any sort of fever and bring down the temperature.
Yeah.
In my honest opinion, as good as the branded products are, I'd go with generic products. For example, Newmark is one of the companies that we tend to work for, who basically sell products branded as cold and flu medication, containing exactly the same ingredients but at a cheaper price and work exactly in the same way.
Brilliant. Well, I hope that's been helpful to you. Thank you very much.